Hello everyone, good to meet you again in Nyambung, a podcast program to get you clicked and connect with me, Dina Praptaraharja, and my co-host Nadila Amani. It is indeed important, Ibu, public health, and I agree that from my engagement as well with the public health communities, given my interest as well in that area, I noticed Cuba is among the shining star there from where we can learn from.
Yes, that's true. And at the moment, they produce 5 vaccine. They produce 5 vaccine, Soberana 1, Soberana 2, and Soberana Plus. This is for COVID. Yeah? I'm talking about vaccine for COVID. Produced by Finlay Institute, and there are 2 other vaccines produced by CIBG. CIBG is a Center of Bioengineering in Cuba. That is under Cuba. They produce 2 vaccine Mambisa and vaccine Abdala. You know what? For vaccine Abdala, the efficacy is 92.28%. So the standard is almost the same level with Pfizer and also with Moderna. And I heard also the news that the other one, the Soberana 2, also reached the efficacy of 92. So this is very high, and they really focus on doing the research on to getting the vaccine to respond with COVID-19. And some countries in America Latin and also Vietnam would like to buy the vaccine from Cuba. At the moment, they are also in the process of registering the vaccine in WHO. So hopefully, we will see that the vaccine of Cuba can be also used through WHO to give to other developing countries. I heard that some of Latin American countries, like from Venezuela, from Mexico, from Argentina, they already start to order the vaccine from Cuba. I am trying to facilitate the Cuban biopharma with biopharma in Indonesia. We already did a virtual meeting with biopharma in Indonesia, and also I was contacted by one institute in Indonesia. I know that Indonesia now is trying to have a vaccine Merah Putih or vaccine Nusantara. This is an opportunity, I believe, for Indonesia to look at Cuban vaccine also. And in the future, probably we can do a kind of joint production together, and joint marketing, especially to developing countries like in Africa, in Asia. So Indonesia is not only the users or the consumption from other countries, but we can also do the production for the vaccine itself.
Oh, okay, Bu Dina, I find it really interesting now that you are talking about how Cuba is now producing vaccine domestically. So it makes me want to ask about how the COVID infection situation in Cuba, Ibu. How is Cuba handling the COVID pandemic, and do you think that Indonesia can learn something from how Cuba handled the pandemic?
Cuba can maintain the cases of COVID-19 through certain measures. Until now, actually, since January, since last year, actually, they can maintain and they can reduce the numbers of people who are infected by COVID-19. But since December, when they started to open, there are some imported cases coming in, and Cuba now still closed for the tourists coming to Cuba. And also the cases lately is quite increasing. So far, 245,000 cases, but then the death because of COVID is around 1,579, and of course, compared than other countries is quite small numbers, but still Cuba should maintain, because the population of Cuba is only 11.2 million people. The other thing that Cuba doing is, until now there is still a curfew until 9 o'clock, and people still should wear the mask even though you walk alone, you drive in the car, so you are still you are mandated to wear the mask. And also, if you don't wear the mask, then you have to pay the fine. Around 1,000 CUP, so it's around $20 US, which is high for the Indonesian, for the Cuban people. Besides that, of course, through the vaccine, Cuba now try to control the spread, and until now, most people already, around more than 50% of the people already get the vaccination, and the target until the end of the year, they will give the vaccination to the whole people. And for Abdallah, the vaccine is done in 3 doses, and not 2 doses like Pfizer and also Moderna or Sinovac, but it is 3 doses. So that's what the Cuban are doing at the moment. And for your information, also the health program here, for the Cuban people, if you are sick and you are hospitalized, everything is free. Everything is free for the hospitalization, for the medicine, it's all free. There are 2 things that you have to know, that for this small country, education is free, even if you are going to take a master degree or Ph.D. degree, is free for the people of Cuban until doctorate degree. You want to be a professor, whatever, is a free education. I mean, the government doesn't charge anything. And also for the health. For example, you get the operation, you want the medicine, you want the MRI, etc. It's free. They don't charge the people. So that's why life expectancy in Cuba is very long. I noted that from WHO, the data from UNDP, also life expectancy in Cuba is 79 years old. This is the data in 2019. And this is a kind of surprising, because in United States, life expectancy is also 79 years old. So almost similar with the life expectancy in a developed country. In Indonesia, life expectancy is 72 years old. So I think the contribution of the health system is also great and big in helping the people to live longer. Okay, thank you, Nadia. I'm going to invite my colleague, Dr. Asep Saifuddin. Kang Asep, can you say something regarding the health, maybe?
Yeah. Morning, Bu Nana. Morning, Bu Dinna.
Salam kenal Bapak. Good to see you.
Good to see you, Bapak.
Okay.
Terima kasih Pak Asep sudah join. Thank you very much Pak Asep. Bu Dinna is Dr. Dinna is maybe you can introduce yourself also, Bu Dinna, and also Pak Asep can introduce so we know each other now.
Yeah, I introduce myself. I'm from Pertamina Bina Medica. It's one of the biggest holding company, state-owned enterprise. Know about the health, especially for the state-owned enterprises. And under the Pertamina Bina Medica, we have 72 hospitals from state-owned enterprises. So in this time, so maybe I want ask to my colleagues, Ibu Nana. Ibu Nana, maybe I just want to a question. What can we imitate from Cuba management of COVID-19? In particular, and in the management of health in general.
I think I get the point of from Pak Asep. He was asking about the management of COVID in Cuba. Is that correct, Pak Asep?
Yes, that's correct. Then
Yes.
and then we can imitate it from Cuba in the management of COVID-19.
Yes, in management of COVID in Cuba, as I mentioned earlier, the cases in Cuba since 2020 is around 45,000 people. 200, I may say less than 250,000 cases. People who died is 1,579 people who died until the data until today, right? The data until today is only, I don't want to say only. It depends on how big is the population. So people who died because of COVID is 1,579 people. Why only small? Can be small, can be big. It depends on how you look at that. Depends on how big the society is. Cuba imposed special measures, very strict measures. Until now, you have to wear masks in the street. Everywhere there is a police, and the police will remind you, you have to wear masks. Even you walk alone, even you are in a car by yourself, you have to wear masks. I just came back from Miami, from United States. Everybody is already open the mask, especially in Florida, where the Republican is very strong there. And I'm afraid because I wear, and people will look at me. It seems like I'm a stranger because I'm wearing a mask. So here, people still wear masks. There's still a curfew until 9 o'clock, until 9 to 5. And then the third one, they limited the flight from international flights. So it's very hard to go out, very hard to get in also to Cuba during this time because they experienced imported cases, especially in January after Christmas. During the Christmas, because zero cases, they started to open the international flights and people came in. The Cuban American, they wanted to celebrate Christmas here. So then it started to rise the cases of COVID again. So now they limited, very restricted for the international flights to come in. No foreigners come in. No, it's only a humanitarian flight. They call it humanitarian flight. They can be allowed. Meaning if they want to see the family or things, so very limited. The other thing, if you go out, of course, you have to get the PCR test. When you arrive at the airport, you get the other PCR test, and you have to stay in the hotel. And then, if you are positive, the result from the PCR test at the airport, automatically the ambulance will come to your place and take you to the hospital automatically. So when you are positive, you cannot stay isolated at home because at home you cannot guarantee that the people will not spread to the member of family. It's a matter of discipline. It's a matter of building habitual practice for the people. Because if you don't do that, if the government don't do that, people is still relaxed, no symptom, nothing. So you just can get out and then all those things. So it's very hard here. Once you get positive, even there's no symptom, ambulance will come to your house. So in every society, there's always a watch. There's always a watcher that see whether you are having and they will also inform you if there is cases in a certain area, and then they will come automatically to your house to get disinfectant, disinfectant, and then also check everybody's. And then Pak Asep, the public health is also assisted by the students. The students every week they go to every door. They knock the door and check the health of the public. So in the community, they have a kind of doctor in the community that live there. It is assigned by the government to live, and the government provide the house, the government provide everything for the doctor to stay, say in airway misalnya, and every week they will check door by door and get the data. So that is a preventive measure. Preventive measure is very important in a small country like this. I think preventive measures should be also imposed in Indonesia because we have a big population. So to control the population COVID spread, we have to do a kind of discipline and also strict measures. That's the thing maybe that I can share. Yeah, Pak Asep.
So in the Havana implemented lockdown policy, Ibu Nana?
Yes. Lockdown policy also. Yeah.
Also.
But now it's already open. When I arrived here in December, it's still locked down. It's so quiet, empty, nothing. So I feel so lonely. But my friends is always together with me. My husband was here at the time. Now he left to go back to Jakarta. But now it's already starting to open. The restaurant also already open, but only to go for takeaway. You cannot dine in. Yeah. So almost the same like in Indonesia, but the problem is here people are more disciplined and they are afraid. They're more disciplined, I say, because they get used like they queuing up to buy things, to buy food. In the heat, in the sun, old people 2 hours waiting to enter the supermarket. And once they arrive inside, the food are gone. They have to go home. So it's just a normal situation here.
Yeah, I think the law enforcement,
is enforcement, law enforcement, and also strict enforcement. Police is everywhere here, and they remind you wear the mask.
Thank you, Ibu Nana. Thank you, Ibu Dina.
Thank you, Pak Asep.
Thank you so much for your support once again. Our podcast is available at YouTube and Spotify at Nyambung with Dina Praptora Harja. Make sure to send us your questions or your thoughts through YouTube comment section. And if you enjoy the episode, don't forget to like, share the link to your community, and subscribe so you make sure you don't miss our contents because we post every week.